All right, this is the horizontal abduction MMT for the shoulder. For this test, we're going to stabilize her upper trap region, and we're going to be palpating her rear deltoid. And I'm just going to instruct Julia to bring her elbow back to me. So Julia, go ahead, bring your elbow back to me, please. Good, I can feel her rear delts activate here. Since she was able to do this, this would be considered a 2. So now I'll add some resistance here behind her arm on the triceps region. So go right ahead, Julia. And if she's able to resist me, she's able to push me back, that would be considered a 2+. For this video, we're going to be performing the shoulder horizontal abduction in the anti-gravity position. For this one, you want the patient laying prone, and we're going to actually rotate their head to the opposite side that you'll be testing. All right, and then I'll be here applying some stabilization to the medial border of the scapula. As I have the patient with the shoulder here at 90 degrees, just try to bring the elbow up in this motion like this. As they do that, I'll be palpating the rear delt. So Julia, go ahead and bring up the elbow. Very nice. Down. Perfect. Now, since she can do this motion anti-gravity, right, now I'm going to add some resistance to see to see better what we could do. All right, so Julia, once you're here, I'm just going to be applying some resistance here. All right, and ready? Here we go. We go mild, moderate, strong, and she was able to withstand strong resistance, so that would be considered a 5. Now, if she would have started to cave in at around that moderate strong area, that would be a 4+. This is a manual muscle test for a scapular adduction, anti-gravity position. So for this test, I'll have the patient bring up their arm, rotate it, rest it up like this, and we're basically going to be testing this motion, right? We're going to be testing the scapular motion right here. So for this, I'm going to be stabilizing on the opposite shoulder, and her head would actually be facing down. She's just looking to the side for comfort reasons right now. But so stabilize on the opposite shoulder, and I will have her perform that action, and I'll be palpating the mid-trapezius. All right, so go ahead, Julie, and try to lift that elbow up. I feel the muscle contraction. Let it relax. And now that I see that she can perform it, now I want to see if we can add resistance to that. Right? So go ahead, Julia, and come to the midway again. Here. Now I'm gonna try to push your scapula down. Please don't let me move you. I'm gonna go from the medial border outside. So go ahead. Mild, moderate, strong. Very nice. She held. So this would be given a grade 5. In this video, we're going to be going over the MMT for the scapular adduction in gravity minimized position. For this one, we want the patient seated with the elbow and shoulder at the same level. And for this one, the patient is going to be kind of pushing the shoulder out this way. Right? So she's going to be using the scapula to push it out, and we have something here to reduce the friction between the arm and the bed. Right? So as I ask the patient to perform this motion, I'm going to be stabilizing on the upper trap and then just palpating the mid-trapezius muscle. So go ahead, Julian, try to bring the arm out. Perfect, and come back in. One more time. Out and come back in. Perfect. All right. So if the patient is able to do this, this will be considered number 2. This is the scapular adduction depression MMT in anti-gravity position. For this one, we're going to instruct the patient to lay down prone. The arm will be out here in kind of assuming a wide position, and the hand can be either supinated or semi-supinated or semi-pronated, whatever you might call this. But we just want the patient to have the arm straight out here, and the movement is not going to be coming from the shoulder, it's going to be coming more from the scapula. So go ahead, Julia, and lift the arm up for me, please. Very nice. And where I'm palpating, you can relax. I'm palpating right in the medial border of the scapula, between the medial border and the spinous processes of the spine. And as she does this, I'll do it one more time. One more time. And I'm mixing here, there. Boom. Perfect. All right. So now, assuming that she would be able to do this with resistance, it would be a 5. So let's try that out. Go ahead, Julia, and bring it up. Very nice. And just hold for me. Hold, hold, hold. Very nice. So as she did this, I applied some stabilization to the opposite scapula, and she held with strong pressure, and so that would be given a grade number 5. All right, so this is the MMT for shoulder scapular abduction and upward rotation. For this, we want the patient seated, and the arm is going to be positioned to about 120 degrees of flexion. Here, we are looking and palpating for any motions between the lateral border of the scapula and the thorax, since this would be the SA region, or the serratus anterior. What I want Julia to do is to basically protrude and then come back. Protrude and then come back. While she does that motion, I'm going to be palpating this region right here. So go ahead, Julia, and perform the motion. Very nice. Come back. One more time. And come back. As she did this, I was also stabilizing around the upper trap area. All right, so for the actual test, what we have to do is, what I'm trying to do is push her in and back, just like that. Applying pressure up here and then just pushing her down and back, and she just has to resist that for a manual muscle test grade of number 5. All right, so here we go. All right, Julia, don't let me move you, okay? Here we go. Mild, moderate, strong. Very nice. So that would be a grade number 5, anti-gravity position.
I have a strong essay.
So this time around, we're going to be doing the elbow extension test. This would be supine for anti-gravity. So there we go. I would have the patient right here in this position. I would be stabilizing in the distal humerus, and I would just be instructing the patient to extend her elbow. So please extend your elbow, Julia. Very nice. And one more time. As she does this, I'm going to be palpating the triceps muscles. One more time. Very good. All right, so for the testing position, this will be at 20 degrees of flexion. Here, I'm going to be applying pressure downward towards the table. Okay, all right, Julia, please don't let me move you, okay? Very nice. So she was able to resist against strong pressure. So this will be given a grade of 5. Alrighty, so this is the position to test the patient for tricep extension in a gravity minimized position, manual muscle test. So for this, I will be instructing Julia to grab whatever she is sliding on, either a towel or a sweater, like in this case, and she's just going to be extending in this motion right there. All right, so before she does this, I will stabilize right here on her shoulder or her deltoid area, and I'm going to be palpating the tricep muscle. So go ahead, Julia, and try to extend your elbow. Very nice, and come back. If she's able to do this with no problem, going through the full range of motion, this will be considered grade 2. All right, this is the wrist flexion manual muscle test in the anti-gravity position, okay? So for this one, I will stabilize the patient in her distal wrist, and with her hand flat, fingers extended, I'm going to ask her to come into flexion. So try to bend the wrist upward for me. Beautiful, good. And for this one, I'm palpating the flexor carpi radialis, which would be around here. So here, and I would palpate around here. Go ahead, Julie, and flex the wrist for me again. Very nice, good. Now, when she does it one more time, go right ahead. Right, I'm going to be applying some pressure this way, away from that tendon, right? So in this position, I'm going to resist you. Please don't let me move. All right, so go ahead. Mild, medium, hard. So that would be considered a grade number 5. Alrighty, so this is the goniometry for the cervical spine lateral flexion. For this, we're going to start bringing her hair to the side and just palpating for C7, since that'll be where our fulcrum goes. So Julia, rotate right for me, please. Perfect, now rotate left. Perfect, now straight forward. Forward, boom. So this is C7 right here. You can tell by directly under her necklace, right there. All right, so Julia, I want you to bring your right ear to your right shoulder. Very nice. How does this feel? Good. And then do it one more time. The end feel should be firm in here. All right, perfect. So now to take the goniometry. All right, we're going to place the fulcrum right at C7, just right here. All right, and the stationary arm right down the mid-back, and then the moving arm will be splitting her cranium. All right, Julia, I'm gonna ask you to perform the motion one more time. You move with the mid-cranium about here, and you can come on back. So this would be 48 degrees. Normal range of motion should be 45 degrees lateral flexion. In this video, we're going to be going over flexion of the shoulder complex. To start, we're going to be having the patient supine, arms right by their side. We're going to be palpating the lateral epicondyle as well as the greater tubercle up here. And I'm just going to ask the patient to flex her arm, but I'm going to be stabilizing her rib cage rather than her scapula, which would be more for the scapular flexion. So for this, Julia, please try to raise your arm above your head as much as you can. Keeping it straight. Very nice. And stop. Right, so in this area right here, can you hold this for me? So midline, tubercle, right, there you go. So right now, she is in a 174. You can come back. 174. Now, I'll do it for you. Okay. So you don't have to do anything. All right. Now this is a firm end feel. If I leave it there, now we are at a 178 degrees of flexion. This is the goniometry for the glenohumeral internal rotation. Now, the landmarks for this are going to be the olecranon process and the styloid process of the ulna, styloid process. For this, we have the patient supine and the shoulder 90-90 basically in the middle of internal rotation if she were standing. So now for this, I'll first ask the patient to perform it actively while I stabilize her shoulder joint right here. Alrighty, Julia. Now I want you to please bring your palm to the table and rotate. Okay. Very nice, and hold here. Now the stationary arm will be perpendicular to the floor. Fulcrum of the olecranon. This one here. Now this would be around 60 degrees. Normal would be about 70, and the end feel should be firm. All right, this is goniometry for shoulder abduction. So for this, the landmarks will be the anterior of the acromion right here, so parallel to the sternum, but anterior to the acromion. And then the stationary arm, or the moving arm, sorry, will split both condyles in the elbow joint. All right, so for this first, I'll ask Julia to just raise her arm laterally for me. So just raise your arm to the side all the way as you can. Good. Stop right here. You can relax right there. Good. So this is about 155 degrees of flexion, or abduction, sorry. All right, now come back. Perfect. Now I'm going to be moving you. Please don't engage any muscles at all, okay? Just relax for me. How does it feel? All right? Okay. All right, just relax there for me. And now with the passive range of motion, it would be 168 degrees. Oh, before I forget, the end feel is firm, and the normal range of motion should be about 180 degrees. This is the goniometry for wrist extension. All right, so the landmarks here will be the olecranon process, or almost the lateral aspect of the olecranon process. Then we also have around the triquetrum over here, and then down the fifth metatarsal. So the fulcrum will be going here, moving arm here, and then the stationary arm here. All right, so first I will ask Julia to please extend her wrist as much as you can. Perfect. And form the triquetrum, olecranon, now the fifth metatarsal, metacarpal, sorry. There we go. And this is about 45 degrees of extension. All right. Now, I will be doing the passive range of motion. So I'll just flex Julia's wrist all the way up here, stabilizing down here. Very good. How does that feel? Okay. Now, put them in the landmarks again. Perfect. So passively, you can see how Julia now has about 63 degrees of extension, which normal range should be around 70 degrees. This is the goniometry for the first metatarsal extension. The axis of rotation here should be right underneath the metatarsal joint right here. The stationary arm would be straight down the midline of the foot, and then the moving arm should be parallel to this right here. All right, so first I will ask Julia to please perform this motion or extend your toes, okay? All right, and you can relax. Relax, very good. Wait, what's the thing for this? 70? So this would be a total of 70 degrees of extension, which is just hitting the right mark. All right, you can relax. Good. So now palpating the landmarks, palpating very light. She's very ticklish. All right. Here. Cool. Okay. Now I will perform it passively. So I will just be bringing that finger up to extension. All right. Now I realign. Down here. Increase just a little bit. Now I've reached about 71 degrees of extension. And yeah.